What are 5 tips to help you in an outpatient setting? So we both currently work in an outpatient setting, and we've also worked in an outpatient setting in the past at our old jobs, and so we wanted to share our experience and our knowledge with you. If you're new to the field or if you're just figuring this all out for yourself, we wanted to make it smoother for you to help you along the way.
So the first tip I'd give you for an outpatient clinic is making good use of your time. So whether that's being productive or prioritizing, this can be really important. Outpatient clinics can be busy. You have a lot of people coming in, you have notes to write, you're communicating with other people, and I feel like if you don't stay on top of it, the day can get away from you. It all starts with preparation. Preparation is a great way to make better use of your time. So when I get to work in the morning, instead of scrolling through Facebook or being on my phone, getting ready for the day, know who's coming in and know what I'm gonna need, know who I need to communicate with so the day goes smoothly. The other thing that I think is helpful for time management is organization, and honestly, this is not my strong suit.
So true.
But it's really helpful. Honestly, when Tony or my husband help me keep on task, my day goes so much smoother. So putting stuff back where you found it, keeping the clinic clean, washing down plinths in between patients, and when somebody's not there or say somebody cancels, that's the time to tidy up or organize my notes or get back on track. Those are really helpful. The other thing I think of is when a patient comes in, write part of your note. So during the subjective, when they're telling you their thoughts for the day, write that down in your note. When they're doing their exercises or their activity, fill out the log while they're actually doing it. Because by the time that's over, you've already written half your notes for all your patients. So being prepared, staying on top of it, being organized, I feel like are ways to make your day go much smoother. Hey Tony, your patient's here.
Oh, shoot, I forgot they were coming in. Can you start them on the bike? Who is it, and what are they coming in for again? Another great tip to help you along the way is having a plan. So talk with the therapist, know who's coming in for the day and what treatment you're gonna do for them, know what equipment you need to get, or if they're a max assist and you need some extra assistance from another therapist, know that ahead of time before the patient gets there. And also not only having a general plan, but also a specific plan for each patient that comes in. So know what you're gonna do for each patient. Like when they get there, you're gonna start them on the bike, and then you're gonna move into some exercises, and then you're gonna do some manual therapy after that. Like, have a plan of what you're gonna do with that patient, because it'll make your treatment go much smoother. And don't be afraid to change that plan or to modify it. So if a patient comes in that was really sore from the day before, don't be afraid to change your intervention plan for that day, whether you're gonna skip the bike or try a different exercise, because ultimately it's about helping the patient. So be flexible, be adaptable, but always have a plan. Hey, I know I'm new and all, but I've been reading some evidence on how to treat patients better, and I was wondering if we can kind of use some of those strategies in here.
Honestly, we've done the same thing for like 20 years. It's working, and what you're saying sounds really exhausting, so I'm gonna have to give you a hard no. The other tip I'd give you for an outpatient clinic is to always challenge your thinking. So before I was in the PT school or PTA program, I thought there was like a recipe for care. So hey, what do you do with knees? Or hey, what do you do for back pain, right? But it's not really like that. As you read research, you find there's so many factors related to patients and pain and function that there's not one specific recipe for something. And that's where this tip comes in. Challenging yourself every day to get better at something little can really improve your patient care and the whole experience for the patient. That's the other thing. We can get stuck in a rut. Like if you find something is helpful, like we do the same thing over and over and over again instead of trying something new, trying to make that thing better. So one of the things I used to do at the other clinic I worked at, me and the other physical therapist would challenge each other every day. We'd pick one thing and we would work on it. For example, like we'd say, during the evaluation, I want you to ask as many open-ended questions as you can. So instead of like yes or no answer, like getting the patient to elaborate, because the more we understand about a patient, the better we can understand what we can do to help them. Then we'd pick something else, like hey, when you do manual therapy, practice this technique or work on this. Like we would pick something little and work on it. And before you know it, as you keep doing this every day, I feel like it really can improve your skills.
I think you'd be really good at running marathons, or like, have you ever tried like running a 5K or anything like that?
I mean, maybe I'm just not really interested in that. I was just wondering, like, my neck has been killing me when I've been reading lately, so I was just hoping
No, I think you'd be really good at 5Ks. We're gonna train for it here, and you'll thank me later. Another tip I would give you is to meet the patient's goals, not your own goals. Don't push your own agenda on a patient. For example, if you have a patient who wants to make it up 2 steps to get into their house, and that's what they want to work on, but you notice that their endurance is really bad, don't spend the whole treatment session working on their endurance and working on their cardio, making them ride the bike for 3 hours, you know, because all they really want to do is make it up 2 steps to get into their home. So if you focus your attention on helping them with stair mobility and going up and down stairs, then you'll be much more successful in your treatment of meeting the patient where they're at versus pushing your own agenda on them. Hey, I was wondering if you could give me some pointers on my next patient that I have. I was kind of struggling with it through the treatment session. I was wondering if you'd help me out. What do you think?
I'm sorry, I wasn't even listening. The last tip I have for you is working on communication skills. This is really important, and I told you in other videos that I didn't necessarily know that this was valuable. So I spent a lot of time focusing on the best treatment and the best intervention, or knowing the best research. And without communicating, though, you might not be able to provide those services because you can't explain to the patient why this might be important, or you failed to even listen to what the patient is looking for. The other thing I was going to say too is that patients, actually, when we listen to patients, a lot of times what they complain about isn't that somebody didn't help them get better, but it was that they didn't listen to them. So maybe their doctor or another physical therapist or somebody didn't listen to what they were saying. They didn't take the time for them. They felt like they were too rushed or too busy. I feel like that's the biggest complaint, because even when they've been to a doctor that didn't help them but was kind to them and attentive and listening, they still hold that person with high regard and they respect them, and they would go back to them for something different. So things that I would suggest that you do is, when somebody's talking to you, give them your undivided attention. Move the distractions away. Put your phone down. Move your tablet or computer out of the way. Consider your body language. Make sure that matches what you're trying to say. And the last thing I would say is listening. So the more you ask open-ended questions to allow the patient to elaborate, the better understanding you have of what the patient wants from you or what they're looking for.
Thanks for watching the video, guys. Let us know in the comment section if working in an outpatient setting is something that you want to do in the future. Be sure to like the video and subscribe if you're new. Peace.